And good luck to the Test Iowa team in Waterloo today. And with that, we will open it up for questions.
Governor, there was a University of
Yep.
Iowa report released yesterday that says extending existing mitigation efforts for another 2 weeks could prevent a second wave of infections. Today, we've got the highest number of single-day deaths reported at 12. Why not keep those in place for just 2 more weeks if it can prevent the spread of
So
infection?
that's a snapshot in time. And first of all, I appreciate all the work that went into the model. And just like the model and the recommendations that they put together and the IHME model that Washington put together, there's a wide range of outcomes and recommendations. And so we are able, with the additional testing capacity, with the mitigation efforts that we put in place, and the way that Iowans responded, we were able to flatten the curve. We were able to mitigate the impact on our healthcare resources, as well as not overwhelming our healthcare facilities. And so at this time, which, on a daily basis, we're learning more, and it's rapidly changing as we're gathering information, we're really able to look at things on a case-by-case, real-time basis. And so I think it makes sense to start to loosen up in areas that have seen little to no virus activity, and to do it in a responsible manner. So it's not sustainable for us to continue to lock the state down. We need to start to open it up in a responsible manner in areas that we feel we've seen a stabilization and a downward turn, and some of the other things that we're looking at to start to open them up. We'll monitor it, which we can, and see how the state responds to lifting some of the mitigation efforts and start to move forward. So, we're continuing, I believe, to do it in a responsible way. I think you heard me say that 93% of the positive cases are contained within the 22 counties. So we're not seeing that start to move out. Yesterday, it was 96% of the positive cases were in the 22 counties. That's why I didn't open it up statewide, that we decided to do it, on a county-by-county basis. And we're going to continue to reevaluate every single day and make informed decisions to protect the health of Iowans, but also the livelihood of Iowans as well. When we look at our unemployment claims, we look at the increased food insecurity that we're talking about, when we look at the increased mental health concerns that we're having, and just from substance abuse to domestic abuse, there are a lot of criteria that goes into the decisions that are being made. And so we're going to continue to evaluate that and move forward.
But do you think